Okay, this video is chapter 31C, and we're going to talk about more on atherosclerosis and coronary artery disease. So this is kind of going into more technical details, going through some of the papers. Earlier I had lectures on atherosclerosis, more pictures, plus I got a whole bunch on my regular YouTube channel. The purpose of this lecture is just to go through the chapter in the book from the Medical Reformation, the book by me. Okay, so anyways, continuing with this chapter 31C, is the situation the same in the carotid arteries? The carotid arteries are different than other arteries because there's just one bifurcation. You know, the common carotid artery comes up in the neck and then it bifurcates with the internal carotid going up to the brain, external carotid artery having multiple branches going to the face. The lack of branches means there's going to be less atherosclerotic events. Atherosclerosis occurs where hypertension sends blood at a high velocity to hit the median divider. So imagine that this was the external carotid going to the face and this is the internal carotid going up to the brain. Okay, so when it hits the median divider, it's going to hit the spot in between, the soft tissue in between. It's going to bump off of that, the fast-flowing blood, and be very turbulent, meaning irregular, without directionality. Some of it will be retrograde, going backwards. An excess amount of turbulent blood flow and an excess amount of retrograde blood flow are sensed by the endothelium of arteries as potential injury. So they shed their antithrombotic glycocalyx and they express prothrombotic material. So what I'm saying is high blood pressure for a prolonged amount of time, significantly elevated, injures the arteries at bifurcations, and this causes a healing response that's prothrombotic, prone to clotting, and leads to atherosclerosis, because atherosclerosis is a blood clot. And the big difference between the coronaries and the carotid is that the coronaries have tons and tons of bifurcations, whereas the cervical carotid, cervical means neck, only has the one bifurcation. Okay, the best atherosclerosis theory out of all of them is called the atherothrombosis theory, and the best atherosclerosis reacher is Gregory Sloop, MD, and he wrote a book about cardiovascular pathophysiology. And I've actually spoken to him. Like I said, he's the best one in the whole world. He comes from a pathology background, which again I think is funny because when I was young, I thought the cardiologist, cardiovascular surgeon, interventional radiologist, and peripheral vascular disease were the best experts on atherosclerosis. But no, it's the pathologist because they look at it under a microscope. And you'll see all these guys who deserve Nobel Prizes, they're not going to get them because big money doesn't want the pros to know about this. So Sloop will never get a Nobel Prize for his research on atherosclerosis, and the other great nutrition researchers like Dr. Caldwell Esselstyn, he'll never get a Nobel Prize. You know, T. Colin Campbell will never get one because they don't want this being popularized, the truth about health, that it's primarily related to diet and toxicology. Okay, let's continue on. What is atherothrombosis theory? So athero stands for atherosclerosis. Thrombosis stands for clot. Thrombus is just another word for clot. Dr. Sloop says all the atherosclerosis risk factors cause increased blood viscosity, meaning they make the blood thicker. So this idea of unifying feature of atherosclerosis risk factors is they make the blood thicker. So here's a paper of his, blood viscosity. Actually, it's his book, Blood Viscosity, Its Role in Cardiovascular Pathophysiology by Gregory Sloop, copyright 2017. It's the best book ever written on atherosclerosis. I read everything I can get my hands on atherosclerosis. This is by far the best book. Okay, what does he mean by viscosity? Just the blood is thicker. That's a key point about blood flow, is that blood is not like water. Water is a Newtonian fluid. It doesn't change whether it's at rest or moving slowly or quickly. Blood is different. The slower it's moving or the more stasis it is, the more it's prone to aggregate, to clot. So it's called a thixotropic fluid, unlike water that's a Newtonian fluid. Okay, so things that make the blood thicker. Well, stasis makes the blood thicker because it tends to aggregate. And I think that's why, like, you go for a long drive, you're sitting in the car for 2 hours, when you first get out, you're all kind of stiff and your muscles don't move well. The red blood cells got to free up from each other and start flowing well through the capillaries. Capillaries have to open up, etc. What makes blood thick? Anything that sticks red blood cells together. So red blood cells on their outer surface, they have a zeta potential and negative charges all around them. If you just type this into your computer browser, red blood cell, zeta potential, and you'll see pictures will pop up with all these negative charges on the outer surface of the red blood cell. The negative charges come from things like sialic acids. It's like similar to glucose with a carboxylic acid on it. Cholesterol sulfates, heparin sulfates on the glycocalyx. The carbohydrate structural coating of cells. So things that can make the red blood cells stick together. Let's say you have two negatively charged red blood cells next to each other. They're going to repel each other because they have negative charges on their outer surface. But if you have put a molecule in between that has a positive charge, like let's say these blue pens have a positive charge on them, that will stick them together. And the thick blood makes more work for the heart because the purpose of blood pressure is to pump blood to the top of your head. That's where your cerebral cortex is. You have to pump blood against gravity. So anything that makes the blood thicker, you have to pump harder pressure. If you're pumping a milkshake, you need more pressure than if you're pumping water up there. Okay? And that's what thick blood is like. It's like a milkshake. Normal blood's more like water. Okay, so what makes red blood cells stick together? Fibrinogen, LDL cholesterol, IgM antibodies, and uric acid. Okay, and I got the references here right below if you want to take a look at those papers. How do bridging molecules cause them to stick together? Well, they're positively charged and they're a big enough size that they can overcome the zeta potential and stick the red blood cells together. Okay, rouleau means stack of coins in French. Rouleau formation. Rouleau makes blood thick and leads to hypertension and atherosclerosis. What about all those paleo, carnivore, low-carb, keto diet people who say saturated fat and cholesterol does not cause atherosclerosis? And that's ridiculous. You know, on the internet, people are allowed to do that, but they, I want free speech, but they say all kinds of stuff that's completely not true. It's the opposite of the truth. And they're probably sponsored with, tons of views. Here am I make all these videos, I tell you the truth, I get 200, 300 views, and they'll tell you all this nonsense, and they'll get, 100,000 views or more. So anyways, there's been tons and tons of studies, going back to Ansel Keys in the 1950s, showing that elevated blood cholesterol is associated with increased cardiac events. There was one big study called the Mr. Fit study. Originally, in 1986, there's been a follow-up version of it in 2008. It just showed the higher the blood cholesterol, the more coronary events people had. Okay. Researchers have also shown the mummies of the rich people who were able to eat the high-fat diets and the meat diets had, coronary artery, thoracic aortic calcifications. The importance of measuring blood viscosity. You can just type into Google Gregory Sloop MD and you'll be able to see one of his lectures. Here's another one. LDL cholesterol causes atherosclerotic cardiovascular disease. Evidence from genetic, epidemiology, and clinical studies right here. The Mr. Fit trial, multiple risk factor intervention trial. And there was a lot of patients in that study, 356,000. 356,000. That's a lot. The higher the cholesterol, the more coronary events. And there's been a whole bunch of other cholesterol studies, the 7-country studies, and a whole bunch of other ones. Back in those days, it was probably from the fat, because back in those days there wasn't, all these other complicating variables like vegetable oil or tobacco or high fructose corn syrup or processed food. There's been other epidemiology studies, like in the graveyards of Europe when they did construction on them, that, the people who were eating the high-fat diets, the aristocrats, they had all these manifestations of it, including dish in their spines, whereas the poor peasants eating turnips had much less of these things, suggesting atherosclerosis. Lots of famous aristocrats, kings and whatnot, had gout in the past from their high meat diets. In the old days, peasants couldn't afford much meat. What are some other atherosclerosis theories? Okay, there's the cholesterol theory or lipid insedation theory, and that was also pioneered by Ansel Keys. And elevated blood cholesterol is the major risk factor for atherosclerosis just because so many people have high blood cholesterol. And LDL is a bridging molecule. And the main foods that will increase it are saturated fat, which mostly means animal fat. You get chylomicron sticking red blood cells together, LDL cholesterol sticking red blood cells together. Cholesterol also stiffens plasma membranes, and some think that it increases stiffening of red blood cell plasma membranes. Because remember, red blood cells about 7 microns in diameter. Typical capillary is about 5 microns in diameter. If you stiffen it, it's harder for the red blood cell to pass through the capillary, meaning that pressure will have to go up. Some people say that cholesterol fatty streak is a precursor to atherosclerosis. Dr. Sloop says no. He says fatty streak is not a precursor to atherosclerosis. This is an important statement. Fatty streak is not a precursor to atherosclerosis because the lipids found in atherosclerosis are different than those in atherosclerotic plaques. The lipid and atherosclerotic plaques correspond to those of the red blood cell plasma membrane and from LDL cholesterol, which is what one would expect in a blood clot. Okay, Dr. Sloop says cholesterol and sat fat are just subsets of atherothrombosis theory because they both increase blood viscosity. They both thicken the blood. Okay, here's some more reference. Here's the metabolic factors in DISH, diffuse idiopathic skeletal hyperostosis from this journal here. And DISH was associated with obesity and type 2 diabetes. Oh, DISH as a monastic way of life. Some of the rich monasteries had increased amounts of DISH. Food and disease in the Renaissance courts. Again, the aristocratic, wealthy people were eating more of this stuff. DISH and the Medici, they were pretty wealthy in Florence in the time of the Renaissance. Okay. All right, cholesterol theorists claim that atherosclerotic plaques are mostly due to fat accumulation in the subendothelial space of the arterial wall. And they propose an elaborate series of steps for how cholesterol gets in the subendothelial space. We'll talk about that in just a moment. But another thing is that there's this big push for what's called the inflammation theory of atherosclerosis. And I don't think that's true. And the reason why is I've seen tons and tons. I look at arteries every day, and I seldom see inflammation around the artery. If you have true inflammation, something like a rare disease called giant cell arteritis, you see inflammation, inflammatory stranding in the fat adjacent to the artery. But you don't see that with atherosclerosis. There's a rare type of abdominal aorta aneurysm, we call it an inflammatory aneurysm, where you'll see inflammatory stranding around the aorta, but you don't usually see that. I see thousands of these, okay? You just don't see that inflammation. In addition, if inflammation was such a big deal, why is it so easy to cure it just with a low-fat, low-sodium vegan diet with no oil? Okay, and of course that's going to have a little bit less inflammation. But, Dr. Sloop looks at it under the microscope all the time. He says, no, I don't see any significant inflammation. I see a blood clot. And then you get what is called organization of the blood clot, whereby the macrophages, the immune system cells, come in and try to reabsorb it. And then he also talks about, well, what about the elevation of CRP, C-reactive protein? And according to Dr. Sloop, in his opinion, the CRP elevation is so small with atherosclerosis that it's kind of a joke. He says you need this high sensitivity test to detect it. He calls that pseudo-inflammation, which I thought was kind of a funny thing to call it. He also talks about, there's also some people out there who are saying, oh, atherosclerosis is caused to infection because you occasionally will find a bacteria in an atherosclerotic plaque. And what I think is going on with that is that the bacteria will sometimes just, be saprophytic, meaning that it's a meal for them. A blood clot, they like to eat blood. You grow bacteria on a blood agar plate, a bat plate, that they will just eat it, so to speak. But you don't need antibiotics to cure atherosclerosis. They're not the causative factor. They're just a secondary, they take advantage of it, if you will. Okay, and also Sloop says that C-reactive protein also can be related to the muscles having depletion of their glycogen due to the insulin resistance associated with high-fat meals. And he thinks it's functioning as a myokine signal of decreased glycogen in the skeletal muscle postprandial because of the insulin resistance. Okay, so that's kind of interesting. Okay, according to Sloop, IL-6 and interleukin-6 and C-reactive protein can function as signals related to skeletal muscles as myokines to indicate they're not able to increase their glycogen as much as expected in postprandial. Prandial means after eating. Okay, high-fat meals cause increased insulin resistance. We talked about that at length. Sat fat in particular inhibits complex 3 of electron transport. The best paper ever written on that topic is the Michael Brownlee paper, Unifying Theory of Diabetes Complications. Okay, so then, and by the way, all these little names here speaking in dialogues, I've written a whole bunch of stuff on atherosclerosis, and I've written a whole bunch of, like, Plato's dialogues, conversations between all these different characters discussing atherosclerosis. And so PMP is Plant Man Prometheus, SR is Skeptical Reader, and VP is the Vegan Prophet. So, I kind of had fun doing that, imitating Plato's style of writing. Okay, so then the Skeptical Reader says, but I heard high-fat paleo diets can be helpful for diabetic patients. Now, they all fail their oral glucose tolerance tests. So in the short term, the body thinks it's starving too. You shift into this whole ketotic metabolism that's bad. I actually reviewed that a lot in one of my books called Hot Topics in Nutrition that I wrote a while ago. That was part of the trilogy of books I wrote that started with A Tale of a Tub, How to Improve Blood Flow, then Hot Topics in Nutrition, then Journey to Optimal Health. I had a lot of fun with that, and I actually think that book was better written than this one because I was just focusing on the pros, keeping it tight, making it all work together, versus when I wrote this book, what I was mostly focusing on was getting all the pictures. I put lots of pictures in it because I wanted all my illustrations from my lectures to get put into a book. because I think illustrations make everything so much easier to learn new material. Okay, skeptical reader. Come on, there's at least a little bit of inflammation in atherosclerotic plaques because some famous atherosclerosis researchers say that inflammation is an important part of atherosclerosis. And what I would say is, yes, there's a small amount of inflammation that comes whenever you're trying to remove cellular debris. Blood clots, dead tissue, and the immune system tries to remove it. So that's going to cause a little bit of inflammation, but it's not that much. When the hematoma is being resorbed, that's called organizing hematoma. Okay, and that causes a small amount of inflammation. But what I'm trying to say is, think about it from the point of view of Big Pharma. Why would Big Pharma fund somebody to do research on atherosclerosis and claim it's inflammation? Because then they can give another drug to treat the inflammation component. So what they're going to say, the atherosclerosis researchers that are pushing this inflammation theory is, well, we've got one drug to lower cholesterol, but there's some inflammation, CRP is elevated, so we need to give a drug to reduce the inflammation. And Dr. Sloop would counter that with, he thinks that's bogus. The CRP is not an indicator of inflammation. It's an indicator of depleted glycogen stores due to insulin resistance. And the fact, too, you just look at Esselson's work, and Dr. Ornish's work, you just put a patient on a low-fat vegan diet, and you can cure atherosclerosis. You don't need anything specifically to deal with inflammation. And the confounding variable as well, high-fat, high-meat diets do increase inflammation. They increase leaky gut. And I forgot to mention earlier, anything that causes leaky gut will cause more bacterial endotoxins. Gram-negative bacteria have the LPS, lipopolysaccharide. Gram-positive bacteria have the LTA, lipoteichoic acid. And these bacterial endotoxins that get into the blood with leaky gut, they are very, very, very prothrombotic. And that's getting back to the research. Douglas Kell, the English guy, PhD, and the lady, Atheresia Pretoris from South Africa, PhD lady. And you can just type their names into your internet browser for YouTube, for example. Just type in Douglas Kell, Atheresia Pretoris, and you'll see their lectures. They're real good, and especially his lecture where he has two great lectures, I think. My favorite lectures. One is Systems Approach to iron metabolism, I think it is. That one's about an hour long, and that's where he goes through all the dormant bacteria stuff. And then his later lecture where he goes through all the mechanisms of leaky gut-induced endotoxin clotting. And essentially it's amyloidogenic clotting, whereby the high bacterial endotoxins, LPS and LTA, change the shape of fibrinogen, the blood clotting protein. They change it from alpha helix cylindrical into flat beta-pleated sheet secondary protein structure, so it stacks up and aggregates and precipitates, and they cause a very resistant type of clot. It's called dense matted deposits, amyloidogenic clots that are harder for the blood to dissolve. Because normally the blood's always forming little clots, dissolving them, forming little clots, dissolving them. And what he's saying is these clots are harder to dissolve, and they're more likely to travel to locations and start plugging up small arteries and causing damage to the brain, damage to the heart, etc. It's real good stuff. By the way, they're some of the most cited researchers. They're real famous, and they deserve to be. Douglas Kell and Atheresia Pretoris. So they did brilliant work. They also deserve a Nobel Prize, but they probably won't get it because their research kind of pulls you into all this stuff, and nobody wants the pros knowing about all this stuff. Okay, so here's one of the papers, Inflammation, Immunity, and Infection in Atherosclerosis by Libby and Ridker. Okay, so Libby's, one of the cardiologists working at the Harvard Center, and, Harvard sort of, has this big cardiology reputation, and they have done a lot of great work in cardiology, but, and I'll give Libby credit. He's more open and honest about the issues with diet and nutrition, but he kind of has the attitude, in my impression of seeing his lectures, that people don't want to follow all these healthy diets, so we shouldn't kid ourselves that that's going to be the way to manage it on a routine basis. Okay, but him and Ridker have done a lot of research about C-reactive protein and atherosclerotic plaque formation. But like I said too, I read the recent Ivy League cardiovascular pathophysiology books, and there's no mention of Ornish or Kempner or Caldwell-Esselstyn or Armstrong's study on primates. None of that stuff. It never, ever gets into the books. Okay, Dr. Sloop says atherosclerosis is just a blood clot. That's important to know. That's why it's called atherothrombosis there. And I can tell you, I look at CT angiograms all the time. Atherosclerosis, mural thrombus, what's the difference? You can't tell them apart. It's because they're the same thing. Okay? How does the cholesterol get into the subendothelial space? Okay, the center of the artery is called the lumen. Okay? And the lining cells of an artery are called the endothelial cells. Okay? And they, on their surface, they have a glycocalyx with antithrombotic molecules, things like heparin sulfate, antithrombin 3, and whatnot. And they release nitric oxide, a gas, which diffuses into the arterial lumen and prevents platelets from clotting. But like I said, hypertension will injure the arterial wall, and then things become more prothrombotic. Okay. So hypertension-induced endothelial injury is the initiating event. So that's what you always want to know with a disease is what's causing the problem. So the high-fat diet makes the blood thick. The sodium from a high-fat, high-sodium meal, the sodium causes vasoconstriction. Also the lack of potassium, lack of magnesium, lack of nitrates because that person's not eating any plants. All of that stuff predisposes to hypertension. And the high blood pressure starts hitting the soft tissue in between at bifurcations, the junctional tissue right there, and it damages it, and then it generates all this turbulent flow. So you get atherosclerosis beginning at bifurcation. So the initiating event is hypertension, causing injury to the arterial wall, leading to a healing response that includes clotting. And here's something that most doctors don't know. You've got EPCs that cover the clot. EPCs are endothelial precursor cells. As you get older, you'll have less endothelial precursor cells. You'll also have less capacity of the endothelium to produce nitric oxide. So the significance of that is as you get older, you get more fragile. So normally these endothelial precursor cells are floating around, they see a clot, and they cover it up. They jump on top of it, okay? And once they jump on top of it, they form a new endothelium over it, and thus the clot has now been put into a subendothelial location. So they make a neointima. And that's how cholesterol gets into the subendothelial space. Endothelial precursor cells also explain how atherosclerosis plaques can arise in a dialysis graft. So in a dialysis graft, you don't have an endothelium, you just have a graft. But the endothelial precursor cells can cover up a clot and, in a sense, then make it like more similar to a regular artery. Excess turbulent flow activates platelets, so they make the blood more prothrombotic. Okay. Hypercoagulable blood increases the risk of forming a blood clot. Dialysis patients tend to form blood clots in their dialysis grafts. The endothelial precursor cells come and they form a neointima, a neoendothelium over the clot. Okay, skeptical reader says, are there any other theories of atherosclerosis? And then the vegan prophet says, yeah, I'd like to mention Dr. Haverich. He's a cardiac surgeon from Germany who became famous for his idea of the vasovasorum theory of atherosclerosis. And this is also called the inside-out theory because the problem starts on the outside of the arterial wall. Really, it starts in what's called the vasovasorum on the outer surface of the arterial wall. And he thinks that that can thrombose and that can lead to an infarction of the middle of the arterial wall. Okay, here's one paper, Endothelial Cell Dysfunction and the Pathobiology of Atherosclerosis. Haverich, this cardiac surgeon, he wrote a book about the endothelial vasovasorum theory of atherosclerosis. It was pretty good. But of course, he's very selective. He's only going to talk about the vasovasorum. He's not going to talk about any of this other stuff. And he doesn't. Because, a surgeon's not going to say, oh, it's all diet. You could fix this stuff with diet. Then, his colleagues would be pissed off at him. Are you saying people don't need surgery? What's wrong with you? Okay. One thing that was kind of interesting about that, Haverich says, well, if you infarct the middle of the arterial wall due to having thrombosed your vasovasorum, you then weaken the arterial wall, and you can thus have it bulge outward and form an aneurysm. And so what's nice about that, it's a very simplistic, useful way to understand how the same risk factors for atherosclerosis are the risk factors for forming an aneurysm in your aorta. Okay. What does the famous cardiac pathologist Dr. William Roberts have to say about the causes of atherosclerosis? He just says, look, the most common probable cause for atherosclerosis is elevation of blood cholesterol. It's by far the most important thing. And that's based on an entire life of studying atherosclerosis. Okay. And basically, how else does he say this? Because he looks under a microscope at it all the time. He's the guy who does the autopsies on the patients who die of heart attacks. And Sloop is also a pathologist, but Sloop does other things besides just the cardiac pathology. Pathologists are the ones who actually look at the atherosclerosis plaque under a microscope. And they're the best experts also because they don't care. A surgeon has to say surgery is good. A cardiologist has to say stents are good. Also, they have to say drugs are good. In conventional medicine, you get in trouble usually if you contradict your own field too much. You piss people off. Okay, let's see. Both say that atherosclerosis is an organizing thrombus, both Sloop and Dr. Roberts. And you can also see, and they've shown pictures in their articles, I've seen pictures in other articles, that you'll get these laminated layers of reforming thrombus, dissolution, reforming thrombus, and it'll almost look like a tree stump when you cut a tree stump. You know, the rings of the tree, one for each ear, so to speak. You'll get these laminations from clotting lysis, clotting lysis, clotting lysis. You'll also get recanalization. New pathways will find their way through the atherosclerotic plaque. And that's very much like when you have a pulmonary embolism. A pulmonary embolism is a blood clot in the leg going up to the lungs. Okay, a clot that moves is called an embolism. And when it occludes a pulmonary artery, they'll sometimes, in delayed fashion, recanalize, reopen up partially. And what's inside an atherosclerotic plaque, like let's say inside an aneurysm, looks pretty much just about exactly the same. Okay. Atherosclerotic plaques have a lot of fibrotic material. Typically, 70% of an atherosclerotic plaque, a chronic plaque, is fibrotic material. Yeah, because it becomes organized. That's what they meant by organizing hematoma over time, and you have fibrotic material in there, collagen. The typical atherosclerotic chronic plaques also have about 15% fat contents. They contain cholesterol and then some calcification. And we see the calcification. Yeah, I see it all day, every day, because the typical Westerner has tons of atherosclerosis. You can also check a cardiac calcium CT to estimate atherosclerotic risk. But my attitude is it's kind of a joke because if you've eaten a SAD diet, standard American diet, for a couple of decades, you've got a lot of atherosclerosis. You don't need to check a test. Why radiate yourself? It's like a couple thousand chest X-rays or something to do a cardiac calcium CT. Why do that to yourself when you already know what you got? The only exception is I see patients and they just can't understand the physiology. It's over their head. So for them, seeing the calcium is a motivator. Here's the big paper of William C. Roberts again, quantitative extent of atherosclerosis in the major epicardial coronary arteries at necroscopy. Okay, so that's the big honking genius paper, sort of a legacy paper summing up his career, looking at thousands of autopsies of patients who died of heart attacks and ischemia-related arrhythmias. And it's a predictor, the cardiac calcium scan, of cardiac mortality, but it's also a predictor of all-cause mortality. Okay, because the same patients who get coronary artery calcifications, they also are obese and get diabetes and are hypertensive, of course. Okay. Oh, I also, William Roberts says from his research, it's very easy to induce atherosclerosis in a herbivore animal. Just feed them a high-fat diet. He says, but you can't do that in a carnivore animal. And so humans are like the herbivores. And then, why should you care? Well, it's good to have a general idea of atherosclerosis because once you understand it, you can then understand, and Sloop's theory of atherothrombosis, because you can then understand the other risk factors pretty easily. So we talked about hypertension. Hypertension is the most common risk factor for small strokes in the brain. I see them all the time. Some patients have hundreds and hundreds of these little association cortex strokes. And hypertension will also cause lots of turbulent blood flow at bifurcations, and that causes activation of platelets. Activated platelets are more prone to clotting. Activated platelets also can increase the risk of metastatic cancer because they can hide the cancer cells. The platelets will all engulf the cancer cell and they'll hide it from the immune system until it lands somewhere else. Okay. Psychological stress equivalents like sleep deprivation, corticosteroid medications, caffeine will all increase the tendency of blood to clot. Remember, the metaphor is being chased by a tiger in the dark. Well, if the tiger scratches you, you want your blood to clot. So being stressed out, you're more prothrombotic. If you're markedly dehydrated, that's more prothrombotic. If you're iron overloaded, you'll have more oxidative stress. The stress the renin-angiotensin-aldosterone system also will increase oxidative stress. Okay. Advanced glycation products will increase oxidative stress. That's from eating high-fat foods. Some of the high-protein foods are prone to that as well. Stress increases fibrinogen. It also increases von Willebrand's factor and factor VIII antihemophilic factor. Yeah, they're all prothrombotic. They all increase the risk of clotting. Excessive dietary sodium can also activate platelets. Another prothrombotic effect. Things that are stressful, whatever they might be, even like really loud noises, they can generate a stress response and make the blood a little more prothrombotic. Lack of sleep, caffeine, we talked about that. Chronic loud noises. I like what Schopenhauer said. It's a sign of the smarter the person, the less they like noise. because the smart person is thinking about something and the noise distracts them from the thinking, so it annoys them. But if a person doesn't have a thought in their head, they don't mind the noise so much. Okay, infections, like they'll increase IgM antibodies that can stick the red blood cells together. Inflammation, like I talked about, leaky gut. Omega-6 cooking oils also cause a lot of inflammation. They'll cause lipid peroxidation. They'll cause the toxic aldehydes like hydroxynonenal, the whole Tetsumori-Yamashima theory of neurodegeneration and also pancreatic degeneration and obesity. Okay, that's interesting stuff. I made separate lectures about Tetsumori Yamashima and his theories and about why Japan has an increased incidence of dementia. He's a Japanese neuroscientist who figured that out. Okay, high fructose corn syrup in large amounts will increase serum uric acid, which is a bridging molecule, and it also inhibits endothelial nitric oxide, and it also increases insulin resistance because it prevents the insulin from getting into the muscle capillaries because they're vasoconstricted. Okay, so you don't want to be drinking excess amounts of this high fructose corn syrup. I recommend don't drink any of it at all. It also increases the risk of fatty liver. Drinking alcohol also increases the risk of fatty liver and leads to hyperlipidemia, and it's real atherogenic. I think alcohol is a mistake. I recommend don't drink any. Eating meat because of saturated fat, animal protein, and it also often has estrogenic chemicals in it. Trans fats, of course, are really bad. Animal protein is a bad idea. It just causes an anabolic effect on the body, that an activation of mTOR that elevates blood cholesterol. So that's right. Animal protein will elevate blood cholesterol. T. Colin Campbell writes about that as well. All oils are bad for blood flow. Fat is bad, like Nathan Pritikin said. You never want to eat oils, not one drop. All nuts are real fat, 70 to 90% fat. So I don't eat them. I recommend avoiding nuts, just like Esselstyn does. Sodium chloride, that contributes to hypertension. I've talked about that separately. Hunter-gatherers usually eat, around 200 milligrams a day, maybe as much as 500, but really not too much milligrams per day. Splenectomy, because then you get older red blood cells that are less deformable, so they're slower to be cleared from the blood. Hysterectomy before age 35, because you lose the menstruation therapeutic phlebotomy effect every month. That's why women live longer than men, because of menstruation. Because the menstruation lowers their blood counts, their hematocrit, the number of red cells they have in their blood. Plus, the red blood cells tend to be younger because they're replacing the ones lost at menstruation. The younger red blood cells are more deformable, more flexible. Okay, diabetes, you get more glycation of red blood cells, which stiffens them. Plus, you get more oxidative stress from the advanced glycation end products. Hyperinsulinemia also causes increased resorption of sodium from the kidneys, leading to volume expansion, hypertension, inhibition of endothelial nitric oxide, so more vasoconstriction, more clotting. You get a microvasculopathy from diabetes as well. Bad for the brain, bad for the feet. You end up with a lot of toe amputations with diabetes. I see those every day, a couple of them every day. Obesity. Obesity is associated with increased free fatty acids in the blood. You start getting a spillover effect where they start leaking fat into the blood. Okay, fatty liver can be thought of as diabetes of the liver, increased risk of fasting hyperglycemia. Okay, was a good paper. This one, number 67 in the footnote. Blankenthorne, he basically showed whatever fat it was, they all caused more atherosclerosis. It didn't matter which type of fat. All of the fats were bad for atherosclerosis. Sat fat, MUFAs, monounsaturated fatty acids, that's like olive oil. PUFAs, those are polyunsaturated fatty acids, things like omega-3s and omega-6s. Okay, here's another paper. About olive, soybean, and palm oil have similar acute detrimental effects on endothelial function. They're all bad. There is no good oil, so don't listen to anybody trying to tell you that one or the other oils is good in some way. They're all bad for you. They're not a normal food. They're a processed thing that's toxic to your arteries. Menopause, when a woman goes through menopause, she has increased risk of atherosclerosis. You get the Wing-Kessel effect. If you have hypertension for a couple of decades, you can't replace those ascending thoracic aorta elastic fibers after about when you hit maturity in your 20s. So what happens is if you chronically overstretch your aorta due to hypertension, due to high-fat diets and high-sodium diets and a lack of potassium, magnesium, and nitrates because of the lack of plant foods, lack of sunshine, you'll chronically overstretch your ascending thoracic aorta and you'll lose the Wing-Kessel effect. Wing-Kessel effect is like the Wing-Kessel is a thing you pull together, you push together like an accordion to blow air on a fire to get the kindling to burn. And that's also the effect. Your ascending thoracic aorta is like a second heart. When your heart beats, your cardiac contraction systole, the ascending thoracic aorta receives blood and it stretches outward. And then when the heart's relaxed, it has an elastic recoil, and the ascending thoracic aorta contracts inward, and that propels blood during diastole. So you have relatively narrow pulse pressure. You get good maintenance of flow during diastole. But once you lose that Windkessel effect, then you have to pump a higher systolic pressure and have a little bit longer systole in order to get adequate blood pushed out into the circulation to adequately perfuse the brain, for example. Tobacco increases hematocrit, the number of red cells in the blood, so it makes the blood thicker, and that causes hypoxia. It also causes hypoxia for other reasons. There's chemicals in it that promote hypoxia. It's also a vasoconstrictor, so it's bad in 3 major ways, and it contains some carbon monoxide. Bad, 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 bad. Smoking tobacco accelerates aging. I've seen women who, were really pretty and they smoked a lot of cigarettes, and they just aged super rapid. So smoking is a really stupid thing to do if you want to keep your looks. Okay, severe dehydration, it makes the blood thicker. Excess dietary sodium, vasoconstriction, inhibition of endothelial nitric oxide. Okay, it also increases intracellular calcium. Okay, dietary deficiency of potassium. Yeah, the good stuff comes from plants. Potassium, vasodilator. Magnesium, vasodilator. The precursor nitrates, vasodilators. And the antioxidants, anti-stress components. And the fiber, which prevents leaky gut so you avoid the bacterial endotoxins getting into your blood. The good stuff comes from plants because we're designed to eat them. Okay? I could care less about animal rights. If meat made me healthy, I would eat it. Okay? I really don't care about that stuff, but it doesn't. Okay, dietary deficiency of potassium and magnesium, from eating plants. Dietary excess of calcium. Calcium is prothrombotic, and they think that's why taking large amounts of calcium supplements causes increased all-cause mortality because it causes a transient spike in blood calcium levels. Calcium is a blood clotting factor, and it's thought to predispose to arterial thrombosis. Not good. Cold temperatures make you a little bit more prothrombotic. Talking about corticosteroid medications. What about blood cholesterol and lipoproteins? The most important thing to know is total cholesterol. It's pretty easy to follow, and there's a lot of data on that. The Framingham study, the Esselstyn study, they all recommend keeping total cholesterol below 150. People who traditionally have kept it below that almost never have coronary events. You'll sometimes see older people nowadays who will have total cholesterol below 150 having cardiac problems, but a lot of them have had a lot of previous arterial injury from hypertension. They're on statins and they're a little more complicated for all those reasons, or they've got cancer. A real nice painting to look at is the one by Thomas Cole. Thomas Cole wrote a series of paintings called Voyage of Life. It's real easy. Just type that in your browser, Thomas Cole, Voyage of Life, and you'll see them. They're beautiful. It's one of the best set of story paintings ever made, maybe the best one. And the middle-aged guy is going over the rowboat when he's losing his oars, and he's pretty stressful. It's a magnificent painting. The middle-aged guy is the main person who benefits from all this nutrition advice and empowerment, because if he gets his act together for nutrition, he can have a dramatic improvement in his health, live an extra 30 years of good health, keep the Johnson an extra 30 years. Young people, it's real hard to teach them anything because they're so stubborn and they think they're immortal, so they don't listen to you. Old people a lot of times have so much baseline disease, it's harder to help them. And in my experience, most old people, they're kind of lazy, they're not motivated, and they sit there and they make excuses rather than try to get their act together. There's a few who will respond and change, but it's kind of frustrating talking to a lot of them. A lot of the old people I talk to, they're cognitively impaired. They're so mentally slow, they just don't have the intellectual horsepower to really change anymore. And again, they've burnt through their reserve. They don't have a Windkessel effect, etc. So when you get older, you're more fragile. An older person can still have great outcome, but they have to really get their act together and not mess around. I've seen a lot of old people, they stuff like, well, I'm cutting down on oil, I'm cutting down on meat. And I was like, hey, pal, you're not doing me a favor. I could care less. I try to help people, but in my experience, most people are pretty lazy and stupid. No curiosity, no inner drive. And if you don't understand what's going on, then you don't have the motivation. I look at these processed foods like as a poison. I'm not going to eat that crap. Whereas another person's like, oh, it tastes so good. And they don't understand how toxic it is, so they're not as motivated to eat and live in a healthy way. You typically see a loss of the Windkessel effect in Westerners after eating the SAD diet for decades, so they don't have much diastolic flow compared to what they should for a Windkessel effect. And so they'll get more systolic hypertension. They don't get so much diastolic hypertension. And I'm not trying to sound mean or anything. I'm just talking based on a lot of practical experience. Okay? And I wish everybody would have a good outcome. But the sad reality is most Westerners, most Americans that I have seen, they age what I would consider quite poorly. They're fat, sick, and stupid by the time they're 60, and they never turn it around. Almost all of them never turn it around. They just keep on going down, 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 and they sit there and they talk to their friends. They have all these sob stories. Oh, and then I had to get my toe amputated. Then I had a heart attack. Then I had a stroke. And they all just, talk like a sob story, like, oh, what bad luck they have. No, it's because you're stupid and you eat the wrong diet and, you're too lazy and ignorant to learn anything. So that's just the way it goes. You eat the sad diet, that's what happens to people who eat the sad diet. And it's such an easy thing to fix, okay? And I was talking to this internal medicine doctor, and he said to me, he goes, Pete, you figured out all this stuff. You've learned all the research from all these other experts who figured stuff out, all the Esselstyns and the Ornish and all these other ones, and you tell it to people. And you would think anybody with a brain would be so happy to have this information available. But instead, you get, like, why is it so hard to help people? Number one, they're lazy. They don't want to learn. A lot of them are stupid. The next thing is they don't have the intellectual curiosity to learn. But I've also noticed a lot of them get pissed off. When you talk to a regular person and you tell them, look, the reason you're fat and sick is because you eat the wrong food. It's your fault. They get pissed off. They're like, are you insulting me? They take it as an insult. And what I'm trying to say is, an intelligent person would say, it's my fault. That's wonderful. Then I can change it. If it's my fault for something I did, then I can change what I do and maybe I can get better. Rather than a dummy, is like, oh, you're insulting me. You're saying I don't have willpower or something. And it gets into this whole emotional thing and they can't make any progress. And in my experience, lots of people do that. Okay, lower diastolic pressure. We talked about that. Okay. And then, so then the question is sort of like what I was getting at. Are you saying that older people are hopeless? No, I'm not saying they're hopeless, but I'm just saying it is harder to have success in them. They have to have their mental capacity, their intellectual sharps, their curiosity, their inner drive to fix themselves, to improve themselves. If they've got that, they can do great. Most of them don't, but the ones who do can do great. We've all seen a lot of old people who all of a sudden turn their health around, and that's very doable, but they have to drive it through. It's not your doctor's job to make sure you're healthy. It's your own personal job. You've got to do the work, which means optimize your diet, your exercise, your sleep, and avoid toxins. Manage your stress. Okay, metabolic problems. Okay, a lot of old people, they eat junk food. They're sort of poor living paycheck to paycheck eating junk food. They've also got a lot of accumulated toxins. They've got a lot of heavy metal accumulation. They're typically eating non-organic processed food. So all these things are added up. They're iron overloaded. They got high serum ferritins. So again, the older you get, the more fragile you are, the more careful you got to be with your health. But if you optimize all these things, optimize your diet, avoid all these toxins, you can dramatically improve your health. Okay, let's see. Oh, here's another paper by Sloop. The effect of LDL and HDL in blood viscosity to correlate with the risk of atherosclerosis in humans. Talking about the atherothrombosis and the blood sludge rouleau formation effects. What about subtypes of LDL cholesterol? Sloop thinks that's all kind of exaggerated. He thinks the whole oxidized LDL is a big exaggeration to try to support lipid theory and avoid the issues of atherothrombosis theory. Oh yeah, by the way, my total cholesterol, like at the time when I wrote this book, it was 93. Okay, that's my total cholesterol. That's what you get when you eat a low-fat vegan diet. It does sometimes bounce around, and for me, it usually bounces between about 90 to 140. You look at plant-based populations eating 95% or more plant-based, they'll typically have cholesterols in the ballpark of 120 to 140. Some of them, like, in T. Colin Campbell's book in the China study, there were entire provinces that had average total cholesterols in the 90s, even the low 90s. Oh, and then some people say, well, I heard that people with low cholesterol have worse prognosis. What they'll sometimes do is take labs on debilitated people, dying of disease, and say, well, look, they have a low cholesterol. Okay, but those are not sort of a fair representative of a healthy middle-aged population. So they're study distortions to trick people. And you can also look at the epidemiology in these plant-based communities. People are skinny and healthy. There's like zero hypertension, zero diabetes, zero coronary artery disease. Okay, look at the Tarahumara in northern Mexico. Compare them with the Pima who eat the sad diet. The Pima are fat and sick, coronary artery disease, diabetes, hypertension, atherosclerosis, getting their legs amputated. They're sick. Tarahumara are world famous ultra marathon runners, and you get a similar picture. Um, like with the Yanomamo, they eat a plant-based diet. They don't get hypertension and atherosclerosis. Okay, here's some more of the papers to that effect. Oh, that's supposed to be SAD diet. I have another version of the SAD diet that's kind of joking. You just look at the rationing study and the epidemiology, and it's pretty obvious you see this. Wherever people eat the low-fat, plant-based diets, they don't get atherosclerosis and hypertension. And so that's why it's the smart move. Okay, so that's it for this chapter. I hope that was helpful.